In 2023, Osteoporosis Canada released the new Clinical Practice Guideline for Management of Osteoporosis and Fracture Prevention in Canada. These guidelines help healthcare professionals make informed decisions about diagnosis, management, and treatment for the condition. I'm Krista Lamb, and today on Unbreakable, the OC podcast from Osteoporosis Canada, I'll be talking to Dr. Wendy Ward, chair of the Nutrition Guideline Working Group, about the new nutrient recommendations and how we can apply them in our daily life. Dr. Ward is a professor of kinesiology at Brock University in St. Catharines, Ontario. Welcome back to the show, Dr. Ward. It is lovely to have you with us again.
Thank you for inviting me today.
So let's start the conversation with a little bit more about the new guideline. Can you give us an overview of what nutrients are the focus of these new recommendations and how were they determined?
Sure. So there were 5 nutrients that we focused on: calcium and vitamin D, which probably are no great surprise, as well as protein, magnesium, and vitamin K. And we started the guideline process by reaching out to members of the Canadian Osteoporosis Patient Network. There was a survey sent to all members to get feedback from them about the questions that they wanted answers to. And it was these 5 nutrients that were identified as areas of interest. And also of note was that there was interest in knowing about supplementation with these nutrients.
And so previously we focused on calcium, vitamin D, and now it's vitamin K, magnesium, and protein. And so there was interest in these, but were there specific reasons related to bone health why they were added?
I think so. I think, in terms of protein, we see a lot of interest about protein and aging muscle. And I think, the fact that bone and muscle work together for movement, it's just a natural extension of the interest that we would want to know more about protein's role, and particularly protein supplementation for bone health. And in terms of aging, because this guideline update is for individuals 50 years of age and older, we know that as we age, both our muscles and bone, we lose them in terms of quantity and then also in terms of their function as well. So I think that was really just very much a natural extension. In terms of magnesium and vitamin K, I think for a long time now, we've been hearing more and more about these micronutrients in the media. And so it was just sort of a natural interest that came out in terms of those 2 nutrients.
Yeah, it's really interesting. We have podcast episodes on calcium, on vitamin D, on protein, all related to bone health and osteoporosis, and I hope people will check those out. But we don't know as much about vitamin K and magnesium. So can you tell us a little bit about what these nutrients are?
Sure. Magnesium is similar to calcium. It's a mineral, and it becomes part of our bone tissue and helps to give bone strength. It's also involved with vitamin D metabolism because there are a number of enzymes that magnesium is involved with. And magnesium, by the activity with those enzymes, helps to activate vitamin D so that it can have a beneficial effect in our bodies and help with our calcium metabolism. So we start to see how linked in magnesium is with both of these nutrients that we know quite a bit about in terms of bone health. For vitamin K, as the name says, it's a vitamin, so similar to vitamin D, and it has a really important role in bone and specifically helps to activate a protein in bone that helps with the mineralization process. So when we think about mineralization, it's the collagen and the mineral coming together to give bone its strength. So both of these nutrients are quite interesting because we just require them in very small levels, and yet they have these really critical roles for bone health.
And let's talk a little bit about how much do you need? How do you get it? I think people are always wondering when they add these new nutrients in, do they need to get supplements or can they get them through food? And how much are you going to need every day?
Sure. So for magnesium and vitamin K, in our current guideline update, we actually didn't find evidence that we need to supplement with these nutrients specifically. So, what we're suggesting is that for people who follow Canada's food guide for healthy eating, we suggest no supplementation of magnesium or vitamin K to prevent fractures. So, what does that mean in terms of how much you should be eating? Well, I think go back to Canada's food guide and be sure that you are getting, the proper proportions of the Eat Well plate. So, if we think of our plate being divided into 3 different areas, and half of it being fruits and vegetables, and a quarter being protein foods, and a quarter being whole grain foods. In terms of magnesium, it's those green leafy vegetables where we can get a lot of our magnesium, as well as nuts and seeds, beans, whole grains, and there's even small amounts in our dairy foods as well. So you start to appreciate that to get enough magnesium, simply eating a mixed diet is probably going to meet your needs. And for vitamin K, there's K1 and K2. It doesn't matter whether we're getting more of K1 or K2 as long as you're getting enough vitamin K. K1 is the plant form, also known as phyloquinone. And again, it's in a green leafy vegetables. So we see a similar food sources for both of these nutrients. Examples of foods would be kale, spinach, soybeans, broccoli. For vitamin K2, that's the animal form, and it would be in egg yolks, meats, and dairy foods as well. And again, as I mentioned earlier, we need really small amounts. So by consuming that mixed diet, we'll be getting the recommended levels.
And I have a follow-up question. If someone is following a vegan diet, is it possible to get vitamin K2 or is it only in animal products?
It would be in the animal products, but certainly, you would be getting lots of K1, the other form of vitamin K, through your other aspects of your diet. And we're going to have some resources come online soon with Osteoporosis Canada, where people will be able to look and examine their intakes for these 5 nutrients. And that'll be really helpful.
Yeah, it's always so great when you can see these things in a document. So that's going to be really wonderful. I'm sure it'll be a fantastic resource. So let's talk a little bit about protein. How can you calculate what you need every day?
It's quite straightforward, actually. Regardless of whether we're a man or a woman, and regardless of our adult age, we need zero point 0.8 grams of protein per kilogram body weight per day. So the amount of protein we need per day is simply based on our body weight, and then multiplying that by that factor of zero point 0.8. So if you weigh 60 kilograms, you would need 48 grams of protein per day. And one of the practical aspects we think about in terms of protein is getting protein at every meal and trying to distribute our protein evenly during the day and maybe not loading our dinner to be so high in protein at night. There's some literature to show that that may be more beneficial overall in terms of how we use our protein. One of the interesting things with the guideline was that we didn't find evidence for a benefit of supplementing with protein for fracture prevention. So there's a lot of literature out there, and I would say the literature is more advanced in terms of muscle health and using protein supplements and showing a benefit to muscle function. Whereas with bone, we don't have that same evidence available. And I think some of that is because of the studies that are available, that dietary levels, so the levels that people would normally be consuming of, zero point 0.8 grams to 1.3 grams of protein per kilogram body weight is typically the amounts being studied. So we don't have studies that have really looked at supplemental levels of protein in terms of bone health. And I think the other thing that was quite notable in the studies that are available is that most are in individuals that are well nourished. So they're already quite healthy. And so for other individuals who may have other challenges, an individualized approach may be most appropriate. And having those conversations with a health professional or a dietitian on what the specific protein needs would be.
Yeah, it's really interesting how to get the amount of protein that you need. One of the questions we get a lot is, does the source of the protein matter? Is that something that makes a difference?
And that's a really great question, one that we don't have the answer to in terms of bone health. But what I try and encourage people to think about is different food sources of protein and the different nutrients that those can provide. So if we think about a glass of milk, you're getting some protein. You're not going to be getting as much as maybe some other meats like poultry, beef, or salmon. But one thing that you will be getting, in addition to that smaller amount of protein, is a good source of calcium and vitamin D, and even a little bit of magnesium. So you can think about the contribution of specific foods in terms of specific nutrients. And then if you mentioned about vegans earlier, vegan diet, if we think about, beans, nuts, and seeds, those can be a really good source of magnesium. You can get smaller amounts of protein than other sources. So you've got to really think about what nutrients you're interested in increasing in terms of your diet. And of course, a mixed diet, when you put all this together, is really going to help complement and help you make sure that you are getting what you need in terms of nutrients for bone health.
Yeah, there's some great things to think about in terms of the different forms of protein. Can you provide some examples of the different foods containing each nutrient?
Just a friendly reminder about calcium-rich foods and that it really is the milk products, which are going to be your main sources of calcium. And then also that there are, plant-based beverages as well. And if they're advertised as fortified, they will contain the same levels of calcium as cow's milk. I also talk a little bit when I'm talking to groups about eating canned salmon and making sure that you're mashing up the bones in the salmon, because that is really the good source of calcium there. And that can be an excellent source for those that maybe don't consume as much of dairy foods as well. Magnesium, vitamin K, I agree, we've covered that. Vitamin D is also quite hard to get in the diet alone to get the levels that we need. We naturally have vitamin D in salmon, some other fish, and a little bit in eggs. And then, of course, there's a little bit in milk because of our mandatory fortification program. So you can get it that way as well. But it's a much more difficult nutrient to get through diet alone. And that was why in the guidelines, we actually recommend that people follow Health Canada's guidance, which is that individuals age 50 and older actually take a supplement every day of 400 international units per day to help support bone mass. And, when you're consuming that supplement, you're also encouraged to consume as much as you can through foods as well. So there's no problem that you're going to be consuming too much if you are having a diet that's richer in vitamin D plus the supplement. So really, it's vitamin D that's the nutrient of concern if we're strictly relying on our diet for these bone supporting nutrients.
Why are these nutrients so important to bone health and how do they work together? So I wondered if you could tell us a little bit more about that. Is there anything you wanted to add?
Well, just, I think we hear a lot about calcium and vitamin D and just, going back to the fact that they do work together. And I always think of the calcium as sort of building blocks and that the vitamin D sort of helps to get those building blocks in the right position. So vitamin D helps us to absorb the calcium that we're getting in our diet. So it helps us to get the calcium across our guts. And then even at the bone, the vitamin D helps us to use the calcium or to be able to incorporate it into our bone. It can also help us to conserve the calcium that we're excreting in our urine. Protein is really nicely linked in because when we eat our protein rich foods, of course, protein's broken down into amino acids, again, like building blocks of bone. And then those amino acids come together in our body to help us form proteins such as collagen that are so important for the strength of our bone. And that collagen becomes embedded with minerals such as calcium and even magnesium as well. So there's a lot of common linkages. And as I mentioned earlier, magnesium dependent enzymes are important for some of the vitamin D metabolism and getting vitamin D in its active form.
And I know for people listening, a lot of times they have concerns about fractures. Do these nutrients minimize fractures at all?
Well, certainly, all of these nutrients are going to help to support a strong, healthy skeleton. What our guidelines showed is that supplementing with these nutrients doesn't seem to give us an added benefit if we're otherwise healthy and not taking medications for our osteoporosis. And I think that brings us to a good segue that for individuals who are on medications for osteoporosis, or sometimes called pharmacotherapy, that it's important that there be an individualized approach and make sure that the diet is appropriate given the medication that the individual is receiving. We know that a lot of studies that studied individuals that are on these medications used minimum amounts of vitamin D and calcium supplements to make sure there was enough in the body. So, really important to have those conversations with your healthcare provider.
Yeah, that's great advice because I think sometimes we assume that the correct amount is the amount that we are told in the guidelines, but if you're on a different medication, that might not be the case. Is that sort of what you're explaining?
That's exactly what I'm explaining. And if you read the actual guideline, they use the word insufficiency if you have risk factors for insufficiency for certain nutrients. And that's also, getting back to people may have malabsorption issues. There may be problems with kidneys and liver that may make your needs a little bit different in terms of these nutrients. So that individualized approach is really important to consider.
So interesting and so many exciting things with these guidelines that have come out. I will ask if there's anything that I've missed today that you'd like me to include in this conversation. Is there anything else you think people would find helpful?
I think just keeping in mind about a balanced diet. And I always go back to Canada's food guide, which, is supporting having plenty of fruits and vegetables, eating protein foods, and encouraging the choice of whole grain foods. And I think that's really good advice that is not only good for our bones, but our overall health.
Wonderful. And thank you again for joining us on the show today. It was lovely to have you back with us.
It's my pleasure. Thank you.
I'm Krista Lamb, and you've been listening to Unbreakable, the OC podcast from Osteoporosis Canada. Today, I've been speaking with Dr. Wendy Ward about the new Osteoporosis Canada Clinical Practice Guideline for Management of Osteoporosis and Fracture Prevention in Canada. If you'd like more information on osteoporosis, visit our website at osteoporosis.ca. If you have questions or comments about this topic or about our podcast, reach out to us on our website or via social media. You can follow us on Facebook and Instagram. Enjoying the show? Hit subscribe in the podcast provider of your choice. Thanks for listening.